Well, the healthcare industry, like many others, is facing major transformation through the use of advanced analytics and big data. Researcher Wise Guys report says the global healthcare big data market will hit $34 billion by 2022. Let's discuss this changing landscape with SAP Health Global President Thomas Laur. Thomas, thank you so much for joining us. And, you know, this is all happening when just a few days ago we heard about this deal between CVS Health and Aetna, right? And part of that is going to be gathering all of this big data to drive down drug prices, to better track healthcare information. So tell me first, I mean, is a lot of this reality or is this just hype when we talk about big data and healthcare?
No, it's, first of all, thank you for having me on the program. It's really a pleasure. Look, the reality is that this is happening, right? These deals are very serious. The intensity of capital and talent allocation to all of the intelligent technologies in healthcare is very meaningful. Fundamentally, reconciling the equation of healthcare between an improved outcome and a reduced cost, data management, data integration, querying data, coming up with predictive insight is absolutely required. Mm-hmm. So AI, artificial intelligence, as well as all the other big data technologies, machine learning, cognitive computing, and tomorrow quantum computing are absolutely necessary to really unleash the promise of digital health. You're right, some of the large transactions that we've seen over the past couple of days, weeks, and months are really focused on creating large healthcare delivery platforms by bringing all this data together and trying to drive efficiencies out of those systems.
Right, but the data is so different, right? I mean, there's a difference, Tom, between data on your phone that's tracking where you are and what you like to eat and all that sort of stuff versus data that's really about your health, which is so private. I mean, isn't that the biggest hurdle when you're using big data, in the healthcare industry, is that a lot of this data is so private, it goes through security. Security is a big concern.
You're absolutely right. Absolutely right. The framework of data privacy for healthcare-related data is highly complex. It's regional, and in many cases, it's local. Data privacy laws change from one region to the other inside of a country. So first of all, the complexity is about normalizing the data, finding a way to bring this data together from different types of formats, sources. That's one dimension. But the broader issue here is really about the gap between what the technology affords us to do and what the law allows us to do. Mm-hmm. And there's still a gap today. We're not allowed to really manipulate data in a way that's free enough to really unleash the power of technology. The answer, in my opinion, here in the future is that we're facing today a patient that increasingly acts as a consumer and really wants to be in control of their healthcare. This patient in the middle of the equation here is increasingly going to give us consent to really to let his data being manipulated for research purposes or technology medical progress. And I think that shift will help us reconcile the current gap between data privacy frameworks and where technology is.
So what is SAP doing on this front, Tom?
So, well, first it's notable to know that the corporate mission of SAP is to improve people's lives. So, our healthcare unit is a highly strategic division of the entire enterprise. We have a value proposition bifurcated into two promises. First, we're helping our clients run better inside of their current business models by bringing them software solutions that help them address their finance and accounting processes, procurement, HR, supply chain and logistics. And at the same time, we also have a run different value proposition where we bring innovation, digital health. And through that value proposition here, that area of our focus, we're helping organizations in healthcare fundamentally accomplish two things. First, we're helping them do exponentially more with data. We're helping them bring data that's today disconnected together. We're helping them drive insight that's predictive at the level of one patient at a time. And then we're also helping these organizations engage with their end patient as consumers in a way that's much more intimate, much more dynamic. And hopefully through these two vectors, we're helping organizations deliver better care at a lower cost point.
Thomas, David here in Hong Kong. Just a final question here. I mean, we know change is good. It's not always welcome at first, of course. What's the pushback you're getting when you talk to your clients?
Well, obviously there's always a concern around, are we able to protect data as we manipulate it? So, data breach is always a concern. And, on that front, I think cybersecurity is getting more and more sophisticated, data encryption technology. So, we're slowly addressing that concern. On the other side, fundamentally, we're talking to organizations who have spent a lot of CapEx, a lot of energy implementing large systems. And now the question becomes, well, do I need to rip and replace my past investments in order to really benefit from digital health solutions? And here the answer is actually you don't have to rip and replace. Most of the digital health value propositions are presented to the market and deployed as cloud solutions, and therefore they can be incremental to the existing stack. But these two dimensions are typically, the biggest, the two major dimensions of resistance when we talk at the enterprise level. The challenge in the middle, really, is always about drive behavioral change that can be sponsored and championed by the physicians. And so when you bring new innovative digital health solutions inside of a system, whether it's a payer, a life sciences, or a provider, you always have to ask the clinical side to sponsor you and really to push adoption of these new models at scale.
Thomas, we got to leave it there. Certainly lots more to talk about when it comes to this space. Of course, we welcome you in the program again in the future. Thomas Laur, their SAP Health Global President. You can find actually more on our series, The Future of Healthcare, on our website. Just head to Bloomberg.com/future of healthcare. More details on this story and certainly all the interesting facets that are in store ahead.